Enjoy the ride with Crystal Petrie Consulting. So inspiring, pushing you to your dreams.
Hello, and welcome to another episode of 60 Minutes With. I'm your host, Crystal Petrie. Joining me today on the podcast is Dr. LeKeitha Morris. She's going to educate us all on a little known career field called speech language pathologist. And she's even going to educate you on if you need these services. So welcome to the podcast.
Thank you so much. Thank you for having me.
Absolutely, Dr. Morris. I am very excited about this because, as I stated in my introduction, speech language pathologist is little known. I feel like only people like within the industry might know about it. Mm-hmm. So my first question for you is, what is a speech language pathologist?
Okay, a speech language pathologist is a trained professional who's been trained to work with individuals who have communication disorders or communication impairments. And so, for example, maybe you have a person who has had a stroke and is suffering from, they know what they want to say, but they're not able to get those words out. Or children who are having problems beginning to learn how to talk or not producing sounds properly, or someone who stutters. And so we work, and then voice. We have professionals who work with individuals who may have laryngeal cancer and they're struggling with voice or vocal nodules, and then we also work with swallowing. So anything from here up that has to do with this mechanism or cognitive processes in the brain. We work with individuals who have suffer from Alzheimer's dementia, and so anyone or any person who has any type of communication impairment or trouble learning to communicate, as in children.
Now, a lot of the examples that you gave me are medical related, but how does someone know if they need a speech language pathologist, like for their child?
Yes.
Or even an adult that doesn't have dementia or any of the items that you named?
Right. We are, I like to think about our profession as being educational and medical. So I mentioned that children who are struggling to learn how to talk. Perhaps you have a child who had multiple ear infections as a kid, and so they weren't hearing or processing language in the way that they needed to. And so for very young children, which that tends to be my area, I live in the birth to 5 realm. For very young children, when children go for wellness checkups to their pediatrician, let's say a child is 2 or 18 months, or even as young as 8 or 9 months, and we're not seeing some of those precursors to speech. They're not making eye contact with you. You drop a pan in the kitchen and the baby doesn't turn into that direction. Maybe there's something going on with their hearing. And so that's one of the ways a pediatrician may make a referral. You have a 2-year-old who's not talking or only saying 2 words. Many times it's when children begin school, when they start pre-K or kindergarten, a teacher starts to recognize that these children aren't communicating in the same way as other children they have seen. And so we may get a referral from that angle, and not necessarily from a medical professional.
Do you see common, maybe not, more specifically from parents that, oh, my child will just grow out of it. Oh, they're just 2. By the time they turn 5, it'll be fine.
Yeah, sometimes we see that, and one of our areas is in the area of prevention. Part of our scope of practice is to educate families and individuals about developmental milestones and what children should be due at certain points in development. And so we really try to educate. I do teacher training workshops, parent training workshops about what is typical language and speech look like, and if we're not seeing that, then what can we do to access the services of a speech language pathologist? And I often tell families it's better to be safe than sorry. So if you have some concerns, bring those concerns to your pediatrician and get that referral that you need. I work at Lamar University, and we have a speech and hearing clinic, and so we do speech and language evaluations for children and service those children if we find that they need the services of an SLP.
Now, at Lamar, if someone wanted to tap into those services, how would they do that? And Lamar is located in Beaumont, Texas. So how would they do that? And do you serve people outside of Beaumont?
Absolutely, absolutely. We have a clinic that provides services, and the way they would go to the Lamar website. Ms. Tammy Frederick is our administrative associate for our clinic, but contact her, and we have a case history form that she would then email out to get some background information, and then we would proceed for an evaluation based on the information that they provide to us. So for our speech language services, we do not need that within our clinic. We don't have to have a referral from a pediatrician or a medical doctor.
Okay. Now, for adults that maybe haven't had any serious medical conditions, would it be too late for them to see a speech language pathologist if they had some kind of delayed in speech or a stuttering problem or something like that? Like, is there an age where you're a little too old for this?
No, absolutely not. It would, to be able to speak about what services they would need, it would really determine on what's going on with that person. I'll give you an example of vocal nodules. Let's say we have a cheerleader who screams at the games and there's reoccurring hoarseness, right? And so someone like that may see an SLP to learn about vocal hygiene. What are some things that I can do to prevent this from reoccurring? Because we know that some of what we see in that particular population, it's behavioral. So teaching some behavioral changes to address that.
And it sounds like singers.
Yeah.
Would they
They could
consult? Okay.
Possibly, yes.
So
yes,
what
yes.
would be considered some vocal hygiene, as you
Water,
stated?
drinking
Really?
water, educators, teachers, drinking water, not when you singing from your diaphragm and not from here, letting vocal rest when you are hoarse instead of trying to push through and continue talking. Engaging in vocal rest. So if you're hoarse, you really shouldn't be talking at all because that just exacerbates the problem.
Is this kind of service covered by insurance, or do you have to come out of pocket and pay for it?
Many insurance companies cover the cost of speech language pathology services. For children, we have children who have private insurance, but then also Texas Medicaid covers. Our clinic at Lamar does not charge, so we don't take, our speech language pathology clinic does not charge. We don't charge for services. So our speech language pathology clinic is a free clinic. We also have within the department audiology services, which is, I just want to mention it because that is a service that we provide at Lamar as well, but I am not a trained audiologist. They're two separate professions with different pathways to becoming an audiologist or a speech language pathologist.
So if someone wanted to seek out a speech language pathologist, they feel like they need it or maybe their child needs it, I know they could go to Lamar University in Beaumont, Texas, but what are some other ways that they can find a speech language pathologist?
They could Google speech language pathologist in the area and get a list of names. A lot of the local hospitals have outpatient clinics, outpatient services. We have some pediatric therapy companies here in Beaumont. If a child is under 3, we have early intervention services. If that child is 3 or older, contact the district that they are located in to talk to them about getting services through the school district. Also, our national organization, ASHA, A as in Apple, S as in Sam, H as in Happy, A as in Apple.org. You can go on the ASHA website and there's a tab for the public. You can go there and be able to find SOPs in your local area as well. We do at Lamar, when we aren't able to get a person in, we do provide a list of other places that individuals could seek for services.
You mentioned earlier that you also deal with swallowing disorders. Speak to me and explain to me how that works with a speech language pathologist that's helping with swallowing disorders.
Because it's all the muscles here. Our muscles that are located that we use for speaking, and that are used in swallowing and for breathing. Those are the muscles that are involved. And so we as speech language pathologists are trained. We learn that anatomy. We learn how that anatomy operates. And so we have training in how to strengthen some of those muscles, or either offer compensatory strategies for swallowing. It depends on what phase of the swallow is impacted by the weakened muscles or whatever it might be.
What if someone, or when someone engages a speech language pathologist, what are some things, I guess, tangible and non-tangible that they can hope to gain from that service?
Better communication. That's the goal, right? Is communication. And so when you engage with a speech language pathologist, I tell my students this all the time. Our goal is to communicate. Now, because the word speech is in our title, many people think that we want everybody to talk, right? And that's not the case. We are communication specialists. So we do have certain disorders or communication impairments where we know individuals will not be able to talk, or they have a degenerative disease that eventually they will not be able to talk. And so we have methods that we use to help people communicate, whether that be body language or alternative and augmentative communication, where they may be using a device to help them communicate, or low-tech technology, written communication. And so so what do you gain from working with an SLP? If you have struggles in communicating, what you gain is the opportunity and the ability to communicate with the individuals in your environment, whether it be family, friends. The purpose of speech is to communicate. And so, yes, we want individuals to be able to talk if that's the goal, if that's the family's goal. But if we can be of assistance in a different modality of communication, we are definitely open and ready to work in that area as well.
Is communication disorder considered a medical disorder? Because when I think of like medical disorder, I think of maybe like heart attacks, or like a virus or a disease or something like that puts you in the hospital.
Some communication impairments are due to medical diagnoses, like a stroke, right? Like a traumatic brain injury. And then some of them are educational. So, the purpose is to increase a child's ability to succeed academically, right? And so in our field, we address both. But no, all of the things that would cause a communication disorder are not medical. And all SLPs are trained to work in medical settings, and all of them are trained to work in educational settings. And you can decide as you start to explore your career options which route you may want to take. But as an entry-level professional, you can choose either path.
If someone wants to be a speech language pathologist, what is that pathway? Is there one specific pathway or several different ways that you can become that?
There are a couple of different routes you could take. It all ends at the same point. So initially you would obtain your bachelor's degree. Many SLPs have bachelor's degrees in the field, in speech language pathology, communication disorders, speech and hearing sciences. There's a bunch of different names out there. And then you have some others who obtain a bachelor's degree in a different area and then decide they want to do speech language pathology. And so there's another option for them. But our traditional students, my pathway was I obtained my undergraduate degree in speech language pathology. And then in order to become a nationally certified speech language pathologist, it does require a master's degree. That's our entry level into the profession, is a master's degree. Most graduate programs are 2 years. You have some that may be 18 months. Some people do a part-time program that may take 3 years, but it's that undergraduate degree, and I'll just say in something. And then a master's degree, and then you have to do what we call a clinical fellowship year. It's a 36-week full-time, and you can do it part-time, but full-time is called a clinical fellowship year, where you're working full-time as an SLP. You're an independent SLP, but you're still getting mentorship from somebody who's certified. And then there's a national exam that you take, and then you become nationally certified and can work in any setting that you so choose to. And so that's the pathway. I mentioned individuals who don't have an undergraduate degree in communication sciences and disorders. You can obtain a bachelor's degree, and then you can apply to graduate school. It depends on the program. Some programs will want you at Lamar. We have a set of courses that we want students to take prior to applying to our graduate program. We call it our leveling program. Some programs will call it a post-bac option, where there is a set core courses in the field that you take and then apply to graduate school. Some programs will allow you to take those courses as a part of your graduate degree program, which then, of course, prolongs the graduate degree. So there are a couple of other options, but to become nationally certified, you do need to obtain the master's degree. But a lot of fields are like that. I think that's the drawback for some students, is the additional education, but it is so well worth it. I tell students all the time, you will have a profession where you are able to find a job, whether you want to work in schools or whether you want to work in medical settings. You can do both if you want to. And so it's a great profession that I would really like for more students to know about early on, because it is very competitive. But that's okay. If we know that from the beginning, we know how to make the move to the next step.
Now, I am a graduate of Lamar University in Beaumont, Texas, and I'm going to be honest, I did not even know that there was a speech language pathology degree like offered at that school.
Mm-hmm.
And I feel like a lot of people don't know about this career field and don't know about this degree plan. Why do you think that is?
I think as a profession, we need to do a better job of advertising and educating individuals about our field. And so one of the things that we try to do that is speaking at local high schools, talking to individuals at community colleges, spreading the word in our faith-based organizations. Anytime we have an opportunity to be in front of young people, then we need to be talking about speech-language pathology, because it is a great career choice. It is one in which, I tell students this too, it's one in which it can be lucrative, but what better can you have than to go to work every single day and know that you are helping to facilitate the gift of communication, whether that be in a child who, says mama or mommy for the first time at 2 years old, and that mom has never heard those words before, or whether that be in that grandmother who had a stroke, having problems swallowing, and she gets her Coke, and you are part of the reason that happened. I mean, how great is that? Now, we all need money, right?
Yes.
We can be having these beautiful flowery careers, but at the end of the day, we have to be able to provide for ourselves and our families. And so it's also very, very lucrative. So to answer your question, we need to be telling everybody that we can about this field. I didn't know about speech language pathology until I was going into my junior year of college. And so I think that it's important to get the word out there about what we do. If you're an SLP out there and you're working, talk to young kids. Let them come and see what it is that you do on a day-to-day basis, because the sooner we can open their eyes to this profession, I think the better we'll be as a profession in having more students that know about the profession in the very beginning, because it is competitive. And when we have students that start in something else and then decide to switch over, if they've bottomed out their GPA, I'm not saying they can't do it, but it just makes that journey a little bit harder. So I think we need to spread the word more about what it is that we do and the impact that we have on individuals' lives.
What are and where are some specific places that a speech language pathologist can work?
Okay. The different settings. There's so many different ones. You can work in schools, in our K through 12 schools. We work in preschools, outpatient clinics. We can go into private practice. We have our own clinic that is strictly devoted to providing speech language pathology services. We can work at universities. I work at a university. I have several colleagues that are there with me who are trained speech language pathologists. We can work in hospitals. We can work in corporate settings, working with individuals on maybe someone wants to go into broadcast journalism and they are from Beaumont, Texas, and they want to move to New York. And they don't want to sound like they're from Beaumont, Texas, right? So an SLP can be involved in something like that. Not a disorder, but it's communication, right? And so we work in home health settings. We work in inpatient rehab, outpatient rehab. There's just a plethora of different early intervention services. It's still, I consider in my mind, that's still home health. Typically when we say home health, we think about adults, but we do go into the home and provide early intervention services as well. So those are some of the different, we can work in health departments. Some SLPs work in for insurance companies, as far as they're in administrative roles in those positions. But this career path, there's so many skills that you learn that are transferable to different areas, and that's what we tell students who maybe have a bachelor's degree in speech language pathology and maybe decided they don't want to do this. The skill set that you get is transferable to other areas. The one thing I did not talk about a few minutes ago on the pathway is we can, in the state of Texas, you can have a bachelor's degree and work in the schools as a speech language pathology assistant. Okay. Prior to receiving that master's degree, or maybe that's what you want to do. You want to work as a speech language pathology assistant, and so that's an option for individuals as well.
If you get your degree in Texas, for example,
Mm-hmm.
can you go to any other state and work as an SLP, or do you have to be licensed in individual states to work there?
A lot of states have licensure requirements, but once you have that degree and you have the national certification, you can practice in any other state. You need to apply for the state licensure, but there's not any more testing involved. Right? You can hold multiple state licenses at the same time. I have a Texas license and a Louisiana license, and so it's just a matter of renewing each of those licenses when it's time, and gaining the continuing education requirements that are needed for each individual state.
And how many, is it hours, I assume, with the continuing education that you have to get each year?
Each year, yeah, it depends on the state. Some states are 10, some are 20. Our national certification is 30 over the course of a 3-year span.
You said that you didn't hear about speech language pathology until you were a junior in college.
Yeah.
So how did you hear about
The
it?
end of my sophomore year, I started out as an occupational therapy major. It seems that high schools are really good, or somebody, maybe it's the PTs and OTs, are really good. I knew about physical therapy. I knew about occupational therapy, but I had never heard of speech language pathology. So I started out in occupational therapy. And my 10th grade year, the end of my 10th grade year, I had a course, a chemistry. I was in chemistry and I hated chemistry. And so the course, it was a English class. Every day when that professor would come in, you know how students were talking before the professor enters. When he would come in, he would hear me talking to the student behind me, fussing about chemistry. And so one day after class, he asked me to stay back and he asked me what my major was, and I told him, and he said, "Have you ever thought about speech language pathology?" "No, what is that?" Didn't have a clue. He said, "Well, you know what? I want you to go over to that department and I want you to just have a chat with my wife. his wife, Dr. D. Lance, was in the speech language pathology department. Went over, talked to her. She encouraged me to take intro to speech language pathology. Took it, loved it, changed my major, been in the field ever since. And so it was another professor who was married to an SLP who, and I've asked him since then, what did you see? What made you?
That's a great question.
And he said, you were very talkative in class. You were complaining all the time about this other major, occupational therapy. They're all kind of rehabilitative sciences. And so he thought, I thought you were somebody who my wife would click with. And we're always recruiting, right? And so that's what he said. But to this day, she's still my mentor. I talked to her yesterday. What? Yes.
So perhaps parents and teachers, the talkative students, are our future SLPs.
That's right. I always say my daughter entered the world, a little miniature SLP. She came out.
I believe it.
No, you do.
I believe it. So what about, and maybe, it goes back to your now mentor, what did she say, or what about intro to speech language pathologist made you say, this is it. This is what I want to do with my life?
That class, we talked that day, and she recommended that I take that class. But it was in that class that I felt like there is something it's a power. I still write it in things now. There is something very powerful and rewarding and believing you're fulfilling a purpose when that purpose has to do with either, giving the child the ability or helping a child gain the ability to communicate, or being that person that is helping to help someone learn those skills all over again, or being that person who works with families to teach families how to adapt for that grandmother who is in the beginning stages of dementia, right? So for me, it was this idea of helping someone be able to communicate. I often think about, if I couldn't communicate, what would that look like? Right? What would that look like? And whether that is using verbal output, speech, or if it's making eye contact. I can look at my babies, my children, and they know what I'm saying without saying a word. It's the eyes, it's the body language. So being able to be that profession or be that individual person who is helping to give people those skills, I love what I do. So for me, what clicked was, I can help people communicate. We all want to be able to communicate, right? When miscommunication happens, we see what happens when communication goes bad. Communication is powerful, and as a person on earth, for me, in my opinion, it's one of the greatest gifts we possess. So to be engaged in either giving a child that gift or helping facilitate that for our geriatric populations, I just love it. I love it. And so that's what it was for me. And thank goodness, no shade to my occupational therapist out there, but whew, am I glad I changed.
So I'm assuming you didn't have to take chemistry in that.
Well, I needed to finish it, and now, for those of you out there, chemistry, our field for accreditation purposes, and to get that master's from an accredited program, we do now have to have a physical science and biological science. So chemistry falls in that realm. So yeah, chemistry is on my transcript. I didn't drop it because I was almost finished with it, but yeah, that how weird is that was one of the things that pushed me in this direction. But yeah, I love it. It's a great profession.
The saying goes that conversation rules the nation, but really we need to put SLPs in there somewhere, because without you, how would we even have the conversation?
Yeah, or communication is what rules the nation. Yeah, it's It's a powerful tool. It's a powerful tool. The ability to communicate can take a situation that is going well and, make it plummet, or it can do the opposite with the right communication skills. And so it's a very important skill or profession that we need to make more of our young people aware of and know about, because they don't. They know about nursing, they know about attorneys, they know about STEM, but this is a profession that is scientifically data-based, evident. Everything we do in clinical practice is based on evidence. So we are scientists, right? And so we just need to get the word out more.
And hopefully this podcast and the information that you're sharing will help people at least be introduced to speech language pathologists. If nothing, just hearing those words, because I had never even heard the term speech language pathologist.
Yeah, and I mentioned audiology briefly earlier. If you have a student, is because audiology, we need more audiologists as well. If students are more interested in the ear or specific anatomy, then audiology is a route as well. And we, our department at Lamar, we're speech and hearing sciences. So at the undergraduate level, you don't specialize. Like, you don't have to choose. You don't have to know at the undergrad level. You make those decisions post baccalaureate. So after you finish with your bachelor's degree, you decide which route you want to take. There are people out there that do both, right? They're a certified SLP and an AUD, and they have an audiology degree.
And I have Dr. LeKeitha Morris here with me. Of course, you have your advanced degrees in speech language pathologist. And without asking you to age yourself, how long have you been in this career?
Oh my goodness. And I always say my age. It's okay. If I say it, if it comes out, it's okay. I have been a practicing speech language pathologist since 2002. So 21 years I've been in the profession. I finished my master's in 2002 at the University of Central Arkansas, and I worked for, when you asked me about the different settings, I kind of giggled within myself, because I did a lot. I did it all. I used to tell my students I was a legal hustler because I had a full-time job as an as an inpatient therapist at a rehab hospital. And then I did PRN in long-term care facilities. And then I went to an outpatient pediatric center. I worked for 3 years. And then I did travel therapy for 6 months. And then I went back for my PhD in 2005. And I finished it in 2010. But that master's degree, remember I said a few minutes ago, you can pretty much do whatever you want to. When I finished my master's degree, while I was in my doc program, because I was a nationally certified SLP who held a license in the state of Louisiana, I would work some in the summer while I was in my PhD program to help fund my doc program. And so when people ask me how long I've been doing this, I never subtract the years that I was in my doc program, because I was learning to become a clinical researcher, and I was still engaged in clinical practice a little bit.
Not only are you a professor, I'm excited to say you are also an international speaker. You were just in New Zealand.
Yes.
So tell me about that. What was that about?
Oh, we were presenting. I was with a colleague, Dr. Karen Wizard-Hansar, who also is a professor at Lamar in our department. And we were presenting work that we had done. One of my areas of interest, and one of hers, we share this, is the scholarship of teaching and learning. What do we do when we're teaching students, and how does that work? What are the best practices to use when we're working with students, when we're teaching students? And one of the areas that we feel our profession feels strongly about, and it is very important, is this interprofessional collaboration and interprofessional education. And so we were presenting work that we had done at a local preschool with teachers, working with children in language and literacy. And so we had our graduate students who were a part of that program. And so we were presenting some of the findings from that work to show, what our students thought about working with the teachers and how the teachers responded to our students working with them. So that's the work that we were presenting, and it was the study itself was very fun. It's just great to work with students and to see them change over time. Like you create these experiences for them, and to watch them grow over time, and to listen to them talk about the relationships that they began to form with the kids as well as the teachers. It was just an amazing opportunity, and it was great to share that work with colleagues across the globe.
Really?
Yeah.
Congratulations on that.
Thank you.
That was
Thank
amazing.
you. Thank
I
you.
seen that. I was like,
Yeah,
New Zealand.
it was great. It was a really, really wonderful opportunity, and to that work, just to watch our students progress over the course of the semester, that was fun to watch. And Karen and I had so much. It was just great to work together on that project.
I would like to get into some of the numbers as it pertains to pathologists. Did you know, and I'm assuming that you do, that you are one of only 3.6% of African Americans in the field in the entire United States of America? Mm-hmm. Why do you feel like the numbers are so low for African Americans in this career field?
Yeah, it's something that me and various colleagues, we talk about, we work towards, we engage in activities to address that. Our profession is one of the whitest professions in the United States. There was an article that came out about that, and so I think there are a couple of different things that we need to do. And everybody in the profession needs to do. We need to, number one, be very honest and open about our programs and the atmospheres that are within our programs, the environments that we're creating. And so I think intentional work to make sure that our programs are welcoming, and we are doing what we can to educate our students and our colleagues about microaggressions and implicit biases and that type of work. And so that's number one. Number two is still, we talked earlier about the fact that many people don't know about the profession. And so I think that can be said too for our students of color, our Black students. They may have never heard of an SLP before, or they've never been around an SLP. If we think about our smaller communities, there may not be an SLP for 100 miles or so. And so education going into our schools where we know our Black students are and exposing them to this field early on, I think is very important. I think when they come into the field, making sure that when they come into our programs, making sure those spaces are welcoming and not filled with, students aren't being exposed to microaggressions every day. We have a lot of literature in our field that talks about this, and it's so prevalent. It's so prevalent. And so some of the work that me, myself, and others are doing is trying to educate people about those things, and creating some concrete actions that can be taken, as opposed to just continuing to talk about what's happening. As a national organization, what can we be doing to make sure that things are changing? Because our national organization has been talking about this problem for years, for decades, and we're still not seeing really any real change as it relates to increasing the number of Black SLPs. But we also have to go further than that, also to make sure that our Black SLPs aren't perpetuating some of the same problems that others are perpetuating. And so there is a lot to do in that, but I think it starts with individual programs and what we're doing.
As you mentioned earlier, Speech language pathologist is one of the widest careers in the United States, with 94% being white people that work in that field. Why do you think that number is so high?
I think it's because, again, the lack of knowledge, and then also some of the requirements that have been used to obtain admission into our graduate programs. Up until 2020, you had a lot of programs that were, and we still have a lot of programs that are using standardized tests as a huge measure to allow admission. And so, or students were being penalized, for example, using certain dialects. And so it's those type of, we really have to look at some of those admission criteria that we're using and really evaluate those to see how we can make changes to that, so that the field is, and we're not advocating for less qualified students. These students are qualified, but making sure that we don't have barriers that are preventing access. Yeah.
As a Black woman in this field, is it lonely for you, like emotionally speaking, because you don't see yourself reflected in your career of choice?
It is, but what I would say to students, and what I've done for myself, is I've connected myself to other Black SLPs. And now there are, groups that are, if people are social media savvy, there are groups, and we connect when we see each other. I mean, I have a network that supports me and surrounds me. And so I think that's key, and that is critical. But yeah, as a field, it can be very lonely. And if you think about an undergraduate student just starting out, what I can say to you as a 46-year-old woman, that 19, 20-year-old student just hasn't had those lived experiences yet to be able to handle some of the things that our students are facing. I think back to my earlier days in my career, earlier days as a student, and some of the things that, because this stuff has been happening all along. It's not like it just started happening in 2020. It's been happening, but there was this light that was, shone upon it. And so we have to address those things. And we, as faculty, and not just Black faculty, but all faculty and departments, have to be aware and have to be willing to address it, and not just hope it goes away, because our students are struggling when we do that. And so I've tried to be within my own department and surroundings, try to be that person for our students. But it takes all of us. It's not enough Blacks or just SLPs of color for the burden to be just left on us. It's just not enough of us. We're 92, I think 92.8% white or something like that. It's 8% that don't identify as white. So that's just not enough. Out of, we have programs that there's no faculty of color in at all. So what does that mean for those students? That means that the white faculty are going to have to do what needs to be done in order for those students to come into the program, feel like they're wanted, needed, and have in place what they need in place to be successful.
Do you think the white faculty wants to take on that burden?
I think there are some that are. I think there are some that are happy. It doesn't affect me and mine, so it's not my problem. I think there are those attitudes out there. But then I also think that there are those who are actively working to make sure that our programs are more, what's the word I'm looking for? More welcoming. Yeah.
Do you think that speech language pathologist was created for Black people? I'm talking about in the career and in the service that it gives.
What field do we have in this country that was created for Black people? I mean,
that's a great.
So
yes, that's a great
I don't
question.
think it was created with us in mind at all. Okay. Now I think there is work that has been done over decades because what happens, and the reason why we care about having diversity within the field of speech language pathology, is because our clients and the clinical populations that we are serving are diverse. And so from that perspective, we need diverse clinicians to be able to work with those individuals and to be able to help create policies that are impacting Black and brown people. And so I think it's very important that we pay attention to that, so that our clinical populations can be served and can be advocated for in ways that people that maybe have not had the same lived experiences won't be able to advocate for them and create policies. We need everybody at the table, right, with the voice to be able to make sure that we're doing things that are beneficial for all that it's intended to be beneficial for.
Do you think that children and adults alike are better served by speech language pathologists that look and sound like them?
There's been work that has looked at the race of the provider, and in some cases you have clients who, if there's not a provider that shares their race, they may not want to see them at all, right? And so I don't know, and I'm not in that literature a lot, but I don't know if they're better served. I can say that with our children and with our adults, it helps to have that option, or not even maybe that option, but to have the ability, or to know that even though my provider may not be of my same background, it's important to the profession that the provider that I'm working with has an understanding of the issues that I have, right? Because many times, if it doesn't affect or impact that provider, they may not be reading that literature. You don't have to be Black to understand Black children's language, right? You don't have to be Black to understand that if I'm at a hospital and there are a lot of people in the waiting room for this family member, if I walk out and this person says I'm the grandchild and the daughter is here, it's okay for me to talk, or I'm talking to everybody, but it's okay for me to pose questions to them. Like, if you haven't learned about maybe perhaps cultural differences, you know, I was in my earlier years, this was during the 3 years, I told you I was at the hospital, and I came out of a patient's room one day, and the nurses were at the nurses station, and they were fussing because this grandmother, there were like 30 people in the waiting area, and they were fussing because there were so many people in the waiting area. And I remember getting so upset, but in that moment explaining to them, you don't know they were Black patients, okay. These were white nurses. You don't know the background. This is the grandmother, but you don't know the family dynamics. Stop expecting for there to be the two children and that's it. But that's a lack of cultural knowledge about how this particular family or how cultures operate. And so, does the provider have to be of the same background? No, but do they need, when you're working with families and patients from different backgrounds, you have an obligation to understand different things about those families and those cultures. And so I feel like the more SLPs of color that we have, the more that information has the chance of getting out to the profession as a whole, if that makes sense.
There are several reports that state that African American children are least likely of all cultures to receive or seek out assistance from SLPs, excuse me. Why do you think that is?
I think it's, if you think about our schools and the funding for some of our schools where our Black children are attending, perhaps they don't have an SLP that works in the school. Or perhaps you have an SLP that's there, but they don't understand Black language, African American English. And for fear of saying, for fear of being called racist or whatever, they just say everything is African American English. Can children who speak African American English, can they have a language disorder? Absolutely, yes they can. But perhaps you have a therapist who is not familiar enough with language acquisition in that population, and so they just say everything is AAE, or there's a lack of funding. We know that there's a overrepresentation of our children in special education services. Is that because, everything is AAE and AAE is wrong, so we're going to plop this child in special ed? There's a lot of systemic issues that need to be addressed that it's going to take not only SLPs but a lot of different other professions to address those. And so there are different researchers within our field that that's their area, that's what they work on, and that's the message that they're trying to put out and help others to understand.
Go ahead. I'm
no,
sorry.
That's fine.
Since there's such a lack of diversity within the career and within the profession, I would assume that there are tons of microaggressions, a lot of biases within the field. Can you speak to that a little bit?
Yeah, it is, and that goes back to being able to recruit and retain diverse students into our populations. And I think it goes back also to not only our national organization but state associations and our individual programs, because our individual professors that are working with these students and our clinical educators, it's going to be imperative that we are all educated about these types of things and that we're educating our students about it so that we can try to prevent those things from happening. And when they do happen, addressing them. One of my colleagues, Dr. Brandon Newkirk-Turner, has an article about, and I think the title of it is Doing Our Work, but basically what that work is about is when things happen in our program, how do we have to address it? Let's engage those students in addressing it. And so I think that's one of the things that we need to do within our individual programs, and making sure that our students understand they can come to us when these types of things happen, and they don't have to just suppress it or keep it to themselves, because it's just not healthy. It's just not healthy. And we don't want people so traumatized going through our programs that they never finish.
Can you give me an example or two of some microaggressions that you've either seen, experienced, or heard about within the field?
Yeah, for example, telling a student after they've completed a presentation that they are so articulate. Well, this is a college student, and that's the thing about microaggressions. A lot of times people say it and think that they're giving someone a compliment, right? Or calling attention to somebody's hairstyle for the day. Oh, your hair is so big today. Those type of things. And these are things, and the way I explain it to our students is, microaggressions they catch you off guard. And it's not like just one. You're walking down the hall doing your own thing, and it's like somebody punches you in the arm, right? Well, if they punch you in the arm one time, you're probably fine. But if you get punched in the arm on your way to the bathroom, and you get punched in the arm on your way back to your desk, then you're in clinic or you're doing clinic prep, somebody else punches you in your arm. So it's these subtle, intended or unintended slights that students that are not from the majority background, students from marginalized backgrounds, are experiencing at alarming rates. A client saying, I don't want to see that student because I don't want that student seeing my child because she's Black. That's just unacceptable, right? And so we have to make sure that when those types of things are happening, that we're addressing them, and we're not creating more stress for our students.
When you were talking about the microaggressions as it pertains to the hair, it just occurred to me that I had a professor that would do that to me all the time. He would, when I came in, he would always say, Crystal, you have new hair today. Crystal, you changed your hair again. And of course, I was one of the very few African Americans in that class, but he would announce it to the entire class, and it really made me shrink myself within that class, and it made me feel so bad every time he would do that. But I didn't know how to address it. I didn't know how to handle it. I would just smile and keep going.
Yeah, they're damaging, and they can cause, if you're not careful, you'll start to try to make sure your hair is the same when you go to his class to try to prevent that from happening. And so it's those type of things that we have to educate our students about, that we have to educate our colleagues about, so that these types of things aren't happening. And we were having a conversation the other day, and it's like, you can do trainings and you can do workshops, but this is you really have to walk in it kind of day by day. And I tell my students, it's a journey, not a destination. I'm very sensitive to microaggressions that are related to race and gender, right? There are other areas of identity that I may not be as well versed in. And so I tell my students, if you've told me what your pronouns are, and I use a pronoun that does not reflect what you told me, call me out, because that's a microaggression, right? It's not intentional. It wasn't intentional, but intent has nothing to do with impact. And your intent doesn't take away the impact. And so I tell the students, if somebody calls you out, don't start crying, right? Because the minute you start crying, you put the attention on yourself instead of the person you just caused harm to. So apologize, and then do some self-reflection and try and get better. We're obligated to get better as speech language pathologists, because we cannot be doing this type of stuff to our clients and our peers, our colleagues. It's just unacceptable.
We've spoken a little bit about some of the obstacles for African American students in that field, but what are some of the instruments that are already in place to help African American students or more diverse students be successful within speech language pathology?
I think network. There are some mentoring programs that are out there that are available. I think connecting, creating a network for yourself. Some programs are further along in this journey than other programs are, and so you have to get a mentor in the field and figure out, what does that look like, right? How do you, when you say, Dr. Morris, that some programs are further along than others, what does that really mean? Start talking to your people and figuring these things out. Go on visits. Okay. You can feel, I've walked in programs, I'm like, ooh, it's you can feel it, and so those are some of the things. Some programs are looking at the curriculum. What's being offered in the curriculum, talking to other students of color who may have come through that program, talking to white students that are in that program, getting involved. Any students that are a part of a university that has a speech language pathology program and you're interested in being a speech language pathologist, join the NISHLA chapter. Go to those meetings. Find out who's doing what are within the university, what types of organizations or resources are there on campus for students of color. Getting involved.
Okay. Now, as a Black woman in what's called one of the whitest professions in America, what do you feel that you have done to make a difference within that profession as a Black woman?
I mentor students. I help create study plans for students on the very front end, because I know it's competitive. And students have told me that just my presence is helpful, because you can't be what you can't see. And exactly. I'm going blank right now on whose quote that is. It's not mine. But so just having that representation. But I have been very intentional in my mentoring with students. Mm-hmm. I engage with students. I want to know how they're doing. I want to know what barriers they have in place and what I can do to help to assist in that in their journey. Before I got to Lamar, I was at Delta State University in Cleveland, Mississippi, and I was the department chair. And so, because there's a lack of Black individuals in our profession, one of the things that I would do is, within my budget, I would make sure that every year I personally drove students. We would rent a van, departmental funds, but that was important to me. So I set aside part of the budget to be able to do this. rent a van and would drive. We didn't have a graduate program at Delta State. Drive students to graduate programs so that they could learn more about that graduate program. It started with Jackson State University when my friend I mentioned earlier, she was the department chair then, and they would do an informational or open house where students could come and learn about their graduate, how to apply, types of things that the program was looking for in the application. They do a tour of the department so that these students could be exposed to graduate programs. I felt that that was my responsibility as the chair of that department, knowing that we did not have a grad program for those students to apply to. And so we started that with Jackson State, and then there were other schools across the region. I think the furthest one we ever went to was the University of Missouri. It's like a 6-hour drive from where we were, but that was important to me. So we went to Jackson State, we went to University of Central Arkansas, we went to University of in Mississippi, the W, and so that was one of the things. And when I started at Delta State, our percentages grew over the years because I was engaged in recruiting efforts. And again, never heard of that, but here's a black, they say it's the whitest profession, but here's a black lady, and she's the chair, so maybe I can do this, right? And I'm very open with students about my journey, right? When I applied to grad school, if I were applying to grad school now, I wouldn't get in. Right? Really? I think I had a 3.2 when I applied to grad school. So I wasn't this 3.5 or above that we tend to see now. But, and as a faculty member, I just think it's important for us to share what we know with our students as soon as we can. So that's one of the things that I've done. I'm committed to that population. I'm committed to all of my students. But I do, early on start with those students that identify this as a major, start having conversations with them early, making sure they know how to study, because we don't want them to get in grad school and then not make it, right? So how to study, understanding what those study strategies look like, are some of the other personal ways in which I feel like I've contributed to the growth of the field. Mentoring students, doing undergraduate research with students, being the graduate advisor for different research experiences, exposing them to what all the options are, right? Another thing that I've done is created panels where we would have students practicing SOPs in the field. I remember I did the one year, I had 3 black SLPs who we did a panel, and any student could come and ask them questions about what was your journey like, how did you succeed, what resources did you tap into. I did one for speech language pathologists, and then I did Latinx panel just like that with audiologists, so that the audiologists, we could see our audiologists of color too with the same type of idea. If you want to be an audiologist, here's 3 Latinx audiologists, and you can come and talk to, and with that one I was able to find a male. So I had 2 females and a male for that one, and then my the SLP one was 3 black females.
Are you doing that in college settings or
high
school settings?
This was at Lamar, and so this was it was a Zoom. We just set up a Zoom, and then we told all of our students in the department. But that would be a great idea to do something like that and invite or set it up with like a high school counselor, a junior high counselor, and do the same exact idea, so that again, early exposure to the field. That's right. Exactly. That's right.
Do you feel like you are the black spokesperson for this field?
Absolutely not. No, I'm not the black spokesperson. I don't think we have a black spokesperson. I think that that 3.6%, we're all because all of our journeys are different. None of our stories are exactly the same, but I think that some of us may not even believe that it's a problem in the same way or feel as strongly about it as others. And so no, I would never coin myself as the spokesperson. I am LeKeitha Renee Hartfield Morris, and I tell my story, and I can share stories of students that I've had in the past, and I can share, strategies and tactics that I've used to persist in this profession. And I can share my network, right? I can share my network with other students. And I think one of the beauties of those of us who are in higher education, we try to stay connected, and we try to share resources. Some of us share students. I've known of students that are going to a different program, and try to make sure that student knows the resources that are at that other institution. And sometimes I learn that from colleagues in these other places, but no, I'm not the spokesperson. I don't think we have a spokesperson, because I think everybody has to be
everybody needs to step up.
Yeah.
What is your intention, your personal specific intention in this field of speech language pathologist?
I feel like my intention is to be the best speech language pathologist, clinical researcher, scholar, teacher that I can be, and to help as many students along the way as I possibly can. One of the things that is interesting to me, and it just humbles me, is to get messages or receive letters of support from students. Because at the end of the day, when it's all crazy and it's like the little hamster on the wheel, my students are why I do what I do every single day. So as long as I'm impacting students in a positive way. Now, have I had some students that may not tell you I was the best professor, or they didn't like me as a yeah, you're always going to have those. But in the big scheme of things, to know that I am impacting students, that's what's important to me. All the other stuff is like noise, because I truly believe that it's about our students, because I'm in higher ed, and it's about the clients and the families that we want to serve. Everything I do is going to be directed toward those two pots of people: my families and the clients I serve, and the students that I serve, because I do think that this profession is a profession of service. And for me, this profession is more than a profession. I truly believe that it's part of the reason why I'm on earth, is to be doing this and impacting the lives in the way that I am. So those are my intentions, is to impact students and the families that we serve as speech language pathologists.
Absolutely. Well, thank you so much for giving us your time and your knowledge. And for agreeing to be on the podcast. I really appreciate you, and you've educated me so much with this career field, and I'm sure my viewers can say the same thing.
Yes, and can I say one more thing?
Absolutely.
If there are any high school counselors, even junior high counselors, that you want to know more, or you're interested, please contact us at Lamar. My email address is lmorris6@lamar.edu, and I'm sure anybody in our department would be able or willing to talk about this more. For the students, it's a great profession, and I can't say that enough.
Excellent.
It will definitely be worth all of it at the end. So
Excellent.
Thank you so much for having me.
welcome.
I really enjoyed it, and thank you.
Now, before you get out of here, my very last question is, who do you think will make a great guest on the podcast, but you have to help me get them on?
Okay. I think Dr. Millicent Musioko is a colleague at Lamar, and she's in the Department of Deaf Studies and Deaf Education. Her area is multilingualism and addressing language and literacy in children who are deaf or hard of hearing. So it's a related topic, and I think that there's more for people to know and understand about multilingualism and language and literacy as it relates to children who are deaf or hard of hearing. That's one. And then also possibly Dr. Manta Singh, who is also at Lamar. She's a faculty member in education, but she does a lot with students who are training to become science teachers.
Really?
Yeah, and so I think she would be a great guest. And then also, I've given you 2 kid people. So an adult person would be Dr. Karen Wisenhunt-Sarr, who I was in New Zealand with,
yes.
and but another one of Dr. Wisenhunt-Sarr's areas of interest include cognition and dementia. And so she's working on some things to bring more awareness and how do we work with those families and resources. So she would be another person that might be interested. But in any of those 3 or all 3 of them, I think would just
I'll take all 3.
Phenomenal.
Wow, thank you so much. Yes, I will take all 3, especially because I know I do a lot of reading, and I know with dementia they're starting to see it happen younger and younger. So I would really like to speak with her about maybe, I mean, they haven't figured out why it's, coming on at younger and younger, but I'd love to see what she thinks about that. Absolutely.
Yeah, no, I haven't spoken with any of them, but those are those are 3 things that I think, just based on what we've talked about and what your interests are and the type of guests that you like to have as far as areas related to education. I think that those are some possibilities.
Perfect.
Okay.
Perfect. Again, thank you so much, Dr. Morris, for agreeing to be on the podcast and educating us about the career field and really showing us your passion
Oh, I love
about
this field. Yeah.
And it comes through when you
Thank
talk
you.
about it.
Thank
It
you.
really comes through.
Thank you.
Thank you so much for tuning in and watching. You can find this podcast and all of my others on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.
Sit back, buckle up, enjoy the ride.